Okay, so in this video we're going to continue talking about these movements, and these are going to become extremely important as we move into the muscles, and we're going to describe muscular actions in this manner, okay? So we said that many of the movements are paired, so that when you move this one direction, you have to move in the opposite direction, so you're basically resetting back to an anatomical position. So a paired group here is abduction and adduction. So the basic definition is if you abduct, you are moving away from your midpoint or midline of the body. And so you have to return, and that's done through adduction. You're going to discover that you have a series of adductor muscles, and they will always be found in the medial areas of the body, all right? And your abductors will be lateral, okay? So the joints that allow this movement are condyloid joints, right? Saddle, right? Ball and socket, and you're seeing the ball and socket here. Circumduction is a 360-degree rotation. So it's many planes, right? Multi-axial. And you basically, again, 360 degrees, a circular path. And so condyloid, saddle, ball and socket also do this. And this is one of the greatest ranges of motion, circumduction. All right? Rotation is another general type movement, and it's also not paired in this first example. So rotation, we talked about the ulna and the radius and the atlas and the axis. And rotation is basically about a 180-degree movement, as in like shaking the head. And so pivot joints do this. Now, there's also, we can describe a rotation as moving a part of the body towards the midline or away from the midline. Okay, so in the rotation, not an abduction, adduction, right? So there's medial and lateral rotation, and in this circumstance, and you see it done here through the ball and socket of the femur to the coxa, and so lateral again away from the midline and medial towards. And so we'll talk about a couple of muscles, a number of muscles that do that. This is when it's medial or lateral rotation, it's a ball and socket joint. All right, some special movements, and here again, you still should say plantar flexion of the foot, but it's kind of understood, all right, because it is plantar. It is that's the name for the bottom of the foot or the sole of the foot. All right, so plantar flexion, as already mentioned, this is standing on the toes, right? And this is something that the gastrocnemius and the soleus will do for you, all right? So they allow you to stand upright. Dorsiflexion is moving the surface, if you would, of the foot towards the shin, all right? So, and they are paired opposites. Also concerning movement of the foot is eversion and inversion, as shown here. If you evert something, you are moving it laterally to the outer, and if you invert, you're moving it medially, right? And we won't talk about any actual muscles that do these actions, okay? But do note that plantar flexion, dorsiflexion is because of the hinge joint in the ankle, whereas eversion and inversion is the plane joints between the tarsals that allow for this. So we do want to know what joints allow these movements, and then we look at the muscles that do the movements. Concerning the thumb and the hand, there's a movement called, and it's a special movement, opposition and reposition. So this is when the thumb is brought, right, the fingers are brought to the thumb, and repositioning is when you straighten back out the hand. All right, there's some special movements in the scapula and mandible. All right, so protraction and retraction. Protraction is a forward movement, and retraction is a return. And this is something we do when we chew, so the mandible is capable of doing this. And the scapula can do this. It can move, again, you've got a forward movement, again, gliding, right, as you have the contacts between the scapula, the clavicle, and the humerus. And not the ball and socket here specifically. This is, again, just a singular forward movement, backward movement, right? Elevation and depression is also something that the scapula and the mandible do. For the mandible, this elevation, right, elevate the mandible is for chewing, bring it up, and we're going to have two muscles that do this, right? We'll talk about the masseter and the temporalis. And then depression is actually an inferior, and the platysma does this, but I don't have students learn that specific muscle in lab, but that is one that does help us with depression of the mandible. The scapula, as shown here, can also do this type of movement, and we do have a couple of muscles. I I no longer have students learn the levator scapulae, but that's an elevator, right? And then a depressor. But we'll look at a few others that do this and do a, and that includes the rhomboids and to do the major and minor. Okay. Pronation and supination are also special movements. They are basically due to the joints in the elbow again. So I know that the joint between the ulna and the humerus is a hinge joint, but the joints between the ulna and the radius, right, pivot joint, and that pivot joint allows, right, this pronation and supination. So supine means on your back, and so when you have your palm is up when you supinate, right, and when you pronate, you're turning it over. All right. Some of the examples of synovial joints. So these are things where we specifically look at the features of these joints, and we'll again reclassify them as, hinge and ball and socket and so forth. All right. So in the vertebral column, right, we of course we got to remind ourselves that we have this cartilaginous joint, the symphysis, the intervertebral disc, right? But we're looking here again in synovial joints, so we want to look between the facets, all right? The facets, right, where they come together with the one below here and the one above, right, not shown, the one above is not shown here, right? We would have this kind of plane, because this is a very flat, right, and here we are in the probably thoracic region. And so a flat kind of vertical facet, and they slide. And again, the shape really determines this, right? So in the cervical region, and again, with the exception of our atlas and axis, which are a pivot joint, in the cervical region, so between C3, 4, 5, 6, 7, right, there are these flattened horizontal facets, and because of this, right, we get flexion, extension, and rotation. And again, think about all the ways that you can move your head and who, which joints are responsible for that, or move the neck really, and then the head moves with it, okay? In the thoracic region, again, flattened facets vertically, and so we limit our flexion and extension here, but we do get some rotation, so we can rotate the trunk. In the lumbar, they're curved a bit, so they kind of interlink or interlock, and so rotation is limited in the lumbar region, but you do get some flexion and extension of the back because of that. All right, the temporomandibular joint between, right, the mandibular condyle and the mandibular fossa in the temporal bone, right, is sometimes it's called a modified hinge. I really think of it as a condyloid. They talk about in the book both a gliding and a hinge, and that's, I think, why some books call this a modified hinge. To me, it looks like a condyloid. It doesn't look that much different than what's between, right, the proximal phalange and the metacarpals, so which is a condyloid joint, and it acts like that. Condyloid joints give a lot of movement, right? So we get elevation and depression, as we've talked about, and we get protraction and retraction, and we get excursion, all right? So this is a side-to-side movement of forward and back and up and down, all right? So its dislocation happens if that condyle is pushed out of, again, that fossa. It moves a little bit anterior. You can dislocate your jaw easily, and it doesn't feel good. All right, so in the shoulder joint, all right, this is our glenohumeral joint, so between the glenoid cavity and the humerus. And there's a couple of different, a lot of different names for specialized ligaments here and bursa, but please understand, in the name, we're actually locating these ligaments, and so it'll be easy to pick this out on a test. All right, it's a fairly loose joint capsule, and think about all the different range of motion that you get here, right? I say flexion, extension, adduction, abduction, rotation, circumduction, and this is an easily displaced joint as well. All right, so these are again, it's a synovial joint, so you have your articular cartilage between the head and the cavity. You have the membrane and the fluids here, all right, but then you have all this additional stuff, and we'll look at the supraspinatus muscle when we talk about the muscle here, so that's just a tendon for that. So there's an acromioclavicular ligament, right, so we know between the acromion process and the clavicle, acromion of the scapula, so there's our process, the coracoacromial ligament, so between the coracoid process and the acromion, right? the subacromial bursa, and so forth. So lots of features here to help really, because this is holding, right, the upper limb to the shoulder, all these things, because that's a really shallow connection. All right, this figure shows you a few of these. Again, there's a coracohumeral, so again, coracoid process to humerus, so to the greater tubercle, all right? And they show this in a two-dimensional cartoon here. The glenohumeral, right, and that's shown here. These are ways to, form the edge of the glenoid cavity to the lesser tubercle and neck of that humerus. All right. There's also a transverse humeral ligament. Right? Yeah. So again, you still got language that's telling you that this is the shoulder joint, right? So transverse humeral, shown here, is really a narrow sheet between the two tubercles and connected to the shoulder. The glenoid labrum is again fibrocartilage at this point. So here we see it here, and it's hard to see in a two-dimensional cartoon. So attaches along the glenoid cavity and helps to make better contact between the scapula and the humerus. All right. Other features I say, the strength of this comes from rotator cuff muscles. So you've got a series of muscles around here that hold this in place and connect up to these two bones. And from scapula, they come from the scapula, the muscles, and attach to the greater or lesser tubercles and hold these two bones together. There's a number bursa, right, subscapular, subdeltoid, right, subacromonial, and, sorry, I misspelled that. There's not that N and O in there, acromial, take that out, forgive me, and subcoracoid, all right, so a number bursa, these are bags of synovial fluid, and they reduce friction, all right. I think we'll go ahead and pick up and finish things on the next video, because I don't think I'll have enough time to do this, finish all the rest of the slides. So that seems like a good stopping point, and we'll finish up special joints on the last video.